How are you today, ma'am?
Just fine.
And what's your name?
My name is Sandra Swope.
And where are you from?
I'm from Chesapeake, Virginia.
And Sandra, are you at all familiar with the healthcare debate going on in D.C. these days?
Well, at the very beginning I started to read it
Okay.
when it was the original bill, and I was on page 203 at that
Oh,
time.
wow.
And there were a few things in there that I was very concerned about. The very fact that there was a committee appointed by the president, and I can't remember the numbers, but I remember it was 998, that the president was going to appoint 9 members from the government on this advisory committee, 9 members from the medical profession, and then 8 members from neither, who were not affiliated with the government or the medical profession. There was some concern about that I felt like, when does our government become knowledgeable about who should be on the committee? And this particular committee that is supposed to decide whether, after you have reached your cap with this new health care plan, whether or not they were going to decide whether you were going to have an additional coverage. There was concern about the for doctors.
Right, medical malpractice, right.
Also, the very fact that the government was going to set the scale that doctors could charge for their services. I think a lot more needs to be looked into it. I'm a little concerned about just having a federal plan anyway. You look at Medicare, and Medicare is having a hard time surviving now. So how is this plan going to be paid for? The very fact that illegal aliens are going to be able to buy into the plan, I feel like that if you're going to recognize someone as an illegal alien, well, there's your chance to send them back to where they should come in, where they came from in the first place. There's a lot of issues, I think, that need to be addressed at this time.
Great. Well, thank you very much.